lead to adhesion or tightness. So you have to do some pain-free range of motion.
Seti sir, are you there?
नहीं, मैं सुन रहा हूँ, मैं फोन पे था इसलिए। तो फोन कीजिए। मेरा आवाज आ रहा है ना आपको?
यस सर, आपका आवाज आ रहा है। सर जब आपको स्लाइड चेंज करना होगा तो यू कैन जस्ट टेल मी सर, आई विल गो टू द नेक्स्ट
आ
स्लाइड।
रहा है।
Gagan sir, are you there?
Yeah, just previous slide.
Hello.
Previous slide, please. Okay, we'll continue without any disturbance. I think.
Gagan sir, are you there?
Yeah. So, pain-free range of motion, whatever range is allowed without pain, you can start passive range of motion exercise. This is very much required for the athletes, those who are injured. They should start little bit of movements. Maybe after 1 day or 2 days, they should start at least the pain-free range of motion. You should start. Then you can start isometric muscle exercise. Isometric means there should not be any joint movement. The muscle should contract isometrically or statically, and then it should relax. You can do 10 to 12 repetitions in the beginning, 2 times in a day.
Participants, he will be joining back, right? So the network problem is solved. He will be joining. Swaroop, I would request you please share that PPT so that sir can continue, right?
Sir, the PPT is
Swaroop, are you
shared,
there?
sir. The sharing is there, sir.
Hello.
No? Sir? Sir, hello? आके इधर बैठता नहीं भाई।
Swaroop.
Sir, are you there?
Yeah. So sir will be joining again. Just connect him and then you share PPT so that we can continue, please. Participants, class को next day हम नहीं कर सकते हैं because every day we have scheduled the class, right? And the course is already approved. So class अगले दिन नहीं हो सकता सकती है, आप समझिए. विल ट्राई टू कनेक्ट द स्पीकर एंड आज ही हम लोग क्लास करेंगे. सो स्वरूप जस्ट फाइंड आउट द स्पीकर.
Am I audible now?
Hello.
Am I audible now?
Yes, sir. Please continue. Swaroop will help you in PPT, right? He will be sharing the PPT. आप
Okay, now
उसको,
it is shared ना. Okay.
हाँ, आप बता दीजिए कौन से स्लाइड से करना है शेयर.
जी, the present slide only.
Okay, okay. Please continue.
Yeah.
Thank you.
So, sorry, participant. There is a problem with the internet. Basically, the idea is to give you some brief knowledge about what are the type of injuries, severity of injury that we observe, and what are the first aid or what are the methods we should employ to minimize the extent of injury and to heal the injuries. So I have told two types of injury, acute and chronic. I have told three grades of injury, grade 1, 2, and 3. I have told three phases of injury, acute, subacute, and chronic phase of injuries. So whenever there is any injury occurs, acute injury basically, you have to follow price regimen. You have to support, immobilize the part, apply ice, apply compression, grip bandage, and elevate the part. You have to start maybe after 1 day or 2 days if there is more severity of injury. Passive range of motion exercises and isometric exercise. If you do this type of movement and exercise in the beginning, then in the chronic phase, maybe after 10 days, 15 days, there won't be any tightness, muscle weakness present on the injured area. So you have to start isometric exercise, static exercise 10 times in it at a time, 10 times in one session, and you can do 2 to 3 sessions in a day. Range of motion exercise you can start. Suppose you have lower limb injury, knee or ankle or any part of lower limb, you should do non-weight bearing gait, non-weight bearing walking. You should take any support, maybe a stick or maybe a crutch. And from the field, you should work with the support of somebody around. So you should not put weight on the leg. And you should avoid load bearing, stretching in the beginning. In the acute stage, no stretching, no hot water fermentation, no massage, no consumption of alcohol because it increases the swelling. So all this should be avoided. Next slide. Next slide. Okay. So whenever the injury passes to subacute phase or chronic phase, the management will differ. Management will shift to other form of exercise like whatever is written, the techniques and method of physiotherapy. There are many equipments or machines in electrotherapy and special technique machines are there. In exercise therapy, with exercise, lot many machines are there, lot many types of exercise there. Some basic knowledge you may have before, like what are the type of exercise, isometric exercise, stretching exercise, isotonic exercise, isokinetic exercise. So all this exercise we may have known. So we'll go through go through the type of exercise. So without going into the detail of the form of exercise, first is range of motion exercise. You have started isometric exercise. You have started. Then you can start stretching exercise and little bit of muscle conditioning, muscle strengthening exercise as it crosses to subacute phase to chronic phase. Maybe after 3-4 days to maybe after 1 week, you should start stretching exercise or muscle conditioning exercise. Why I am telling 3-4 days or 7 days? Because it varies, depends on the extent of injury. Suppose there is severe kind of injury, then the acute phase will last for 3-4 days. Subacute will last again, say instead of 7 to 1 week to 2 weeks. So whenever there is decrease of swelling, decrease of inflammation, decrease of pain and tenderness, then you can start a little bit of stretching exercise, muscle conditioning exercise in the form of strengthening exercise. starting with your own body weight or with other body part, like pressing one hand to the other hand, pressing one leg to the other, like with your own body. You can start strengthening exercise. You can add on little bit of weights or TheraBand. You can add for resistance exercise. So this is the exercise that you can do basically whenever the injury passes from subacute to chronic phase. Whenever there is any old injuries, purana injury hai, maybe 1 week to 1 month long duration injury is there. So directly you can start stretching exercise and muscle conditioning exercise. Okay, and whenever there is any acute injury and you're progressing from acute injury, you can start joint range of motion exercise, pain-free movements, isometric exercise. You can start. But whenever there is subacute and chronic old injuries you are seeing, you are encountering, you can start directly muscle conditioning exercise. But for a physio, whenever they see any old injuries, there is tightness in the muscle, stiffness in the joint. So you have to start mobilization exercise, manipulation exercise. These are very skilled type of exercise the physio has to do. They can do soft tissue manipulation, soft tissue therapy with the hand. Electrotherapy from acute stage, I have told cryotherapy. You can, in subacute stage, you should progress to contrast bath, alternate application of heat and cold. Okay, so 3:1 ratio. From cold, we have to shift to hot. So from cold 3 minutes, hot 1 minute. So 3:1 ratio, you should progress to 2:2 ratio and 1:3 ratio. When 1 becomes cold after some days of application, and 3 becomes your hot application. So contrast bath, whole subacute phase should be given contrast bath, alternate application of heat and cold. Then in that much you can do. Like if it is peripheral injury like leg or hand, you can dip in hot water and cold water, ice water. After that, the physio in the laboratory, they can use ultrasonic therapy, ultrasound, what we say, shortwave therapy or microwave diathermy, pulsed magnetic therapy, TENS, trans-electrical. There are a lot many machines to reduce pain, to reduce swelling, and to regain function. So like muscle stimulation, interferential therapy. So lot many machines are there. Next slide. Interferential therapy is there. You can see in the screen. Combination therapy is there. Pneumatic compression therapy is used to reduce swelling, edema. Functional electrical stimulation, the previous one, yeah. Functional electrical stimulation, whenever there is a lack of function because of pain and inability to move, there is the function is affected. The injured person not able to move the body part because of lasting pain and problem. So we can start functional electrical stimulation. The current will help regaining the movement, will assist the movement to occur. Then laser therapy, you have heard of laser therapy. It is very much useful for treating pain and inflammation. Extracorporeal shockwave therapy, it is used in later condition of injury. Whenever there is stiffness or tightness or adhesion formation, you have to break the tightness with shockwave therapy. And iontophoresis and phonophoresis, for the pain you can apply on introduction of ions, medicines like any Volini gel or any pain killing gel. Now we can introduce the gel or ions into the skin or into the muscle through current. And you may have known acupuncture, dry needling. You must have seen needling by the physio to the injured part. So all these are special techniques that can be employed in different stages of, and conditions of injuries. Similarly, in exercise therapy, from stretching and conditioning exercise, we can shift to weight-bearing exercises, strengthening PRE exercises, functional exercise. Now the functional part should be attended. Like suppose you are getting little bit of strength in the hand or in the leg, the function like walking, and for the hand like moving the hand for eating or for doing small activities of the hand. You have to do functional type of exercise, multi-skill training that may be required in the sport. Hydrotherapy is one important aspect treatment that can be given for injured area. Hydrotherapy, neuromuscular control exercises. This can be given whenever there is lack of control over the muscle. Whenever the muscle becomes weak, the control over the muscle becomes less. So you can start neuromuscular facilitation technique, that is called PNF, proprioceptive neuromuscular facilitation technique. You can start. You can start cardiovascular fitness because suppose some athlete is staying in rest without doing any activity for longer duration, then the cardiopulmonary capacity will definitely decrease. So we have to improve with cardiovascular fitness exercises like aerobics or cardio. You must have listened the term cardio exercises, aerobic exercises, and basic fitness exercise can be started. Sports skill, if it is definitely it is required to start any sport after injury. So sports skill and specific fitness should be attended, should be given. So this is the progression of exercise from basic to the advanced level, where the athlete is start incorporate all the functional and sport skill activities can be incorporated. Next slide, please. Next slide, please. Next slide. Okay. So this is the basic treatment or rehab aspect required for any community coaches or the PE teachers. Suppose they encounter any injury in the player and in the children, so they can start giving some first aid, primary care, some exercises. What I said, progressive exercise from passive exercise to active exercise, from isotonic to strengthening exercise or conditioning exercise. They can start stretching exercise. They can start. And if the injury is of more intense, more big, then they should consult any physio for proper treatment. So what is the role of physiotherapist in sports? Apart from treating injury, the role as team professional, as a leader is very much appreciated. The previous one. So the coach, the athlete, and the physiotherapist is a team, and the sports physio needs to have a very good relationship with the athlete. There needs to be a feeling of mutual trust and confidence. The coach is responsible for the training and performance, and it is vital to involve the coach in the medical decision-making process. Basically, as you know, the coach basically gives training, and they have a plan to enhance the performance of the athlete. So the physio should constantly in touch with the coach, should advise for better, should advise about the condition of the athlete and what is the treatment advice, whether rest is advised or not, or what activities is advised. Basically, the coach should know, and there should be proper. The next slide. There should be proper relationship with the coach. It's a team management and team decision that should be incorporated. Next slide. So in the next slide, please. So the physio act as a leader in the medical management of the athlete, and the coach is very much important aspect of any kind of management you do for the athlete. What are the aims of sports physiotherapy? Generally, what are the? This was a very specific aim: the injury management or recovery of the athlete. But the general aims may be to promote health and fitness of the people or society or the person who are coming to physiotherapy, to promote health, to promote physical activity and fitness. The previous slide. Okay. To promote physical activity and fitness, to prevent, correct, treat disability and deformity, to restore functions of the individual, to prevent injuries, to manage and rehabilitate injuries, to provide first aid and prepare athlete on field and take care of athletes on field, to help the body recover and maintain the fitness of the athlete, to assess and plan effective exercise prescription for the athlete for safe participation in sport, to correct any musculoskeletal imbalance, insufficiency in the athlete in shortest possible time, to maintain and improve performance of athlete with all corrective measures and high performance work on the athlete. So these are the general aims of physiotherapy, for starting from basic health and fitness to prevention, to manage injuries. Whenever the athlete will be trained, there will be stress and strain. So body recovery is important, and there are monitoring of the condition of the athlete and management is very much required on field and out the field. Improve the performance of the athlete. Next, please. So what are the broader role of physiotherapists in the team setting? In the team setting means we have different role at different times. Some role on the field and some role in the clinic, some role whenever you are traveling with the team to any destination, to any tournament. So we have different role at different times. In the clinic, basically, we treat or manage disease conditions or injury conditions. We do rehabilitations to the injury, and in training the team, whenever you are in the field, you should prepare the athlete. You should do tapping, bracing, whatever is required to prevent the injuries to occur. You should guide the athlete or help in the warm-up, stretching process, conditioning of the athlete, facilitate recovery in the cool down phase. You should promote, you should facilitate recovery, and you should target the athlete who are having tightness or having any musculoskeletal problems. So what are the type of exercise they should do in the warm-up and specifically in the recovery cooling down phase? What they should do, you should guide in the training team whenever you are on field. So another part of our role is whenever we are touring with the team to different tournaments outside. So we should carry our first aid bag and other things which is required. So on the tour, basically we should identify and plan the timely management of any medical issues, any injury problems, and sensitize and comply with the doping issues. Doping is a big menace, and sometimes the athlete can get trapped with the doping supplements or any type of drink they can consume. So you should guide the athlete what are the things to be taken and what are the things to be avoided. In the competition venue, you should be equipped to provide first aid, immediate care of musculoskeletal injuries, and identify in emergency and conditions required referral. Emergency can happen in any sport, basically combat sports, head injuries, chest injuries, loss of consciousness, loss of vision, loss of mind perceptions. So all that emergencies you have to attend, and you have to refer to suitable hospital or any clinics nearby for proper attention. Next slide, please. Next slide. Yeah. So the role of physiotherapist in the pre-competition workout, like on field, what they should do, they should support the athlete as per the type of sport. Suppose it's a boxing game. Suppose it is a badminton game. Suppose it is a running type of event. So these three type of events are different. So the type of depending on the type of sport, you have to give your support in different manner. Suppose a boxer is there, so maybe you have to tape the fingers, you have to tape the wrist, and a proper supportive device you have to give. And for a runner, maybe you have to do some other type of support on field before the activity starts. So depending on the type of sport, duration, suppose it's a very long duration game or short duration game, intensity of the game, suppose it's a martial art game. So all depending on the type of game, your support will differ. Then assessment and rehab of acute and chronic injury. Before the competition, you should know the athlete if they have any acute or chronic injury. If they have chronic injury, you should attend properly. You should give that much of support and quick treatment for relief of pain and recovery. And suppose there is any acute injury that has occurred recently or occurred in the game, then you should do all acute management support. And there the decision making is required for physiotherapy, whether the athlete has to be allowed to play after the acute injury or not. So this is the decision we have to take. The stretching and muscle activation before training. Nowadays, the warm up has come to very scientific level. Now, before they were doing all sort of general and specific warm up, that is, they are still there. But now, scientific things have come to to muscle activation techniques are there. Very specific stretching or acting on the muscle, which is very important for the game. That are many methods are there to activate properly. So that should be done pre-match or pre-competition. Pre-match strapping, taping support, if it is required, should be given. And importance should be given to the prevention of injury. So you should know the type of injury, you should know the weakness of the athlete. Then you should also employ certain strategy to prevent the injury. Next slide, please. So during exercise training, this was before training, and during exercise training, what you should take care, you should prepare the athlete for the warm up and for the game. You should take care for the prevention of injury, and if any injury is there, like first aid and care should be taken. Any emergency that can occur, you should do the emergency management and refer to suitable hospital. Attending environmental emergency, if at all is there, you have to attend. And scientific support to the coach in training and achieving target is very much important. So all the things is very much important during the exercise training. Next slide, please. So what are the things you should do post competition, after exercise training? After training, what you should do? Basically, it's the recovery that is much required now. So preparation. So recovery and relaxation is required. Recovery of the body, recovery of the mind, relaxation. If at all there is injury, stress and strain is there, a lot of pain or problems or injury can be there. So you have to attend to that. Psychological support, because physio as the support staff very much present with the team without a psychologist in the team maybe. So you have to attend the athlete psychologically support and do the psychological boosting methods to keep the morale high, and whatever the pain and problem is there, they should be able to bear it. So maintenance of sports specific fitness is important post competition. After competition is over, now the importance is on the sports specific fitness to maintain it before the next periodization start. You have to maintain the for that, like we send for swimming, for alternate activities, some recreational activities. So you have to maintain the fitness, and you have to set the goal for future competitions. Like you have to plan it, proper goal with periodization plan. Next slide. So apart from the role on field and off the field, pre-competition, during competition, and after competition, what we should do is it's a general role of like it is not there in the beginning, but a general role we have to do, general work we have to do in the sports sector, like helping the coach and other support staff. Other support staff maybe they are like strength and conditioning expert is there, masseur is there, physiologist or psychologist are there, nutritionist are there. So the physiotherapist is the nodal medical and scientific person with the team. Apart from coach, the physiotherapist is always available. There may not be nutritionist, or they may be there but not with the team. So you have to approach them. You have to get the proper advice, proper protocol to be employed. Like whenever you want body recovery, you may send for sauna or steam. You may do, you advise the masseur to do specific type of massage. You can advise the athlete to go to a physiologist to check the VO2 max or any other parameter. You can send the athlete for medical and biochemistry test to know whether calcium is less or in vitamin D or B12 is less or whatever, like you think that it is lacking. So this is a team support you have to give, and it is a combined effort of all scientists, all along with the coach, that will give the proper result. So this is a general role. And to improve awareness of the athlete, your athlete should not be lacking behind in any aspect, like anti-doping measures. He should know what are the doping issues, fitness issues, what are the in which phase of training like fitness should be attended, and what are the injury and illness problem the athlete is going through. So the athletes should have proper knowledge about himself. I am going through this phase, so that is why I am given this supplement. I am going through this phase, that is why I am doing a lot of strength training. So I am going through this phase, that is why the injury management is going on, and this activity is advisable and this activity is not advisable. So he should be more with knowledge. Then only he can manage himself. One important aspect of ours is pre-participation examination of athlete. So any athlete, before starting any game or beginning of any phase of training, they should go to a physio for pre-participation examination, where the athlete is examined, is musculoskeletal, we say MSK, musculoskeletal examination is done, whether the appropriate strength is there or not, flexibility, agility, speed, coordination, balance, all these things is there or not, or if it is not there, which point they are lacking. Maybe the internal rotator of strain of shoulder is good, the external rotator of shoulder is not that good. Then the muscle imbalance can cause shoulder impingement syndrome or shoulder injury. So we have to attend all this aspect in the pre-participation examination. We have to examine the athlete. Then other health and scientific assessments are there. We have to know what are the biochemistry level, like calcium or vitamin or a protein, like all sort of nutritional aspect, hydration status, how much water he's taking, whether it's dehydrated or not, how is the body weight doing. So all this have to be checked by the physiotherapist, and if at all is any other thing is support is required, then the physio should consult the specific specialist. Mental health is important for the general role. Like we should know the mental health of the athlete. We should give requisite psychological support, psychological training. Nowadays, many things are available in the psychology part, so that can be incorporated in proper time. Management of the individual is very much important. General thing is like therapeutic intervention, rehabilitation, high performance work on athlete to improve performance. These are all general role that we have to employ. Next slide, please. Next slide, please. Next slide.
Please change the slide. Hello.
Sir, I've changed it.
No, the upper one, injury prevention. Yeah. So what is the role in injury prevention? As you know, prevention is better than cure. So it is very much important if you want optimal performance and better performance of the athlete. The injury part should be taken care of, it should be prevented. So that is why you do pre-participation examination to know the weaknesses and strength of the athlete. Then we work on that. Suppose the muscle strength of any body part or any segment is less, we do strengthening. If there is tightness, we do stretching exercise, muscle conditioning exercises. If balance is affected, coordination is affected, then we do exercises for that. So all the aspect of injury prevention should be taken care of. Suppose there is increasing cause, malalignment, flat foot, bow leg, or there is continuous shin pain in the athlete. So all this aspect has to be happening. What type of training he is doing, whether he is doing road running or not. All these things has to be taken care of in injury prevention aspect. First, you should examine pre-participation examination, then implement sport-specific injury prevention program. There is a general program for all athletes, and there is a very specific program for runners. It is different. For upper body like thrower or jumper, it will be different injury prevention program. Suppose for a jumper, so leg and low back is very much important. So strengthening and specific. Am I audible?
Yes, sir. You may continue, please. आप audible हैं.
Okay. So the physiotherapist employs various intervention and methods for correction of biomechanical fault and neuromuscular aspect. So starting from warm up to cool down to taking care of athlete on field in the prevention aspect and proper recovery and injury management, all this can lead to better performance of the athlete. Next slide, please. Yeah. So on-field acute intervention is very critical for a physiotherapist because there can be serious on-field emergencies. There can be bigger injuries like fracture, dislocation, contusion. Lot many greater problems can arise. So acute condition or on-field management is very important. You have to carry proper first aid to the field, and you should know, like suppose CPR is required whenever there is any medical emergencies, the heart stop and there is no breathing, so you have to do CPR. So all the required equipment, manpower should be there on the field, and service is one of them. So it is very much required on field. Then pre-match strapping and taping for prevention of acute injuries, what I said before, is required. Monitoring and intervening as per the performance of injured athlete on field. You should monitor which athlete is have any problem or not. You have to monitor them and intervene in between the game. Suppose first set is over and second set is going to start, then you should go to the athlete and whatever you know about the athlete, we should address that before the starting of second set. So this is the role of physio on field in the acute or emergency condition. You have to do. Next slide. Rehabilitation is very much important for physio. Basically, our role is greater in rehabilitation aspect of the patient or athlete. In the beginning, there is injuries, or the athlete may have taken some medicine to reduce the pain and all. But rehab starts after the initial phase is over. The athlete has to regain proper strength, balance, coordination, endurance. All the aspect has to be regained through rehabilitation. So you have to make a short-term and long-term goal for that. What is the deficiency? What is the problem of the athlete? Suppose there is bigger injury of the knee. Suppose there is any surgery, ACL repair, ACL reconstruction is there. Definitely there will be balance and coordination. So individualized plan, specific plan after evaluation. So with the aim that the injury should not occur again, there should not be re-injury of the same or the other aspect of the body. And the athletes should return back to the ground with better or optimal performance. At least whatever was there before the injury, whatever strength and ability was there before injury should be regained with rehabilitation. That is the aim. Before you allow the athlete to go back to ground, that is called RTS, return to sports, we have to evaluate and you have to find out that the athlete gives optimal performance. At least the strength and endurance or whatever parameters is required, it is at the optimal level. Then in rehab phase, the physiotherapist stresses upon functional training, sports-specific movements. After the injury, pain is over, like it's a part, care about injuries is over. The aim should be to regain functional aspect, like the speed should be there, the agility should be there, the athlete should be able to run, to jump. So all the functional training should be given. Then sports-specific movements should be given, like suppose a racket sports is there or a thrower is there. Like with lower, lesser weight, throwing movements are given by the physio in a different regimen. So all this aspect, like sports-specific movement and sports-specific exercise or activity should be initiated in the rehab phase. Sports performance component, like I said, agility, speed, weight bearing, throwing, all these sports performance components has to be addressed. Next, please, slide. One aspect is for the physio is nowadays very much post-surgical recovery. So nowadays there are a lot many ACL repair. There are bigger injuries of any part of the body, like low back or cervical or knee or ankle. Any part there can be bigger injuries. There can be surgery after fracture or after dislocation or after ligament injury, like ACL, PCL, any type of injury. If there is any surgery, then the athlete activity will be retarded for maybe 1 month to 6 months. So up to that, the physio has get a role to maintain the fitness of the athlete, to recover from the injury what had happened before, and get the strength, endurance, and all the maintain the morale of the athlete. In 6 months, morale goes down. No, I cannot be again play. This problem, like 3 to 4 months, if you do all rehab, it will you will come back with greater strength. There is no problem. So you have to counsel and you have to start the management of post-surgical. It is a day-wise management program for ACL or any bigger repair or surgery. So what you should do on day one, what you should do on after 1 week, after 1 month. So all the regimens are there, but with the aim that in the beginning we should reduce the pain, swelling, and scarring. Then we should improve the mobility, flexibility, strength, balance, coordination. Then we should start daily activities and independence, like walking for the upper limb, maybe whatever the activity may be, like eating or raising the hand or any activity required for the upper limb. So the athlete should be able to do basic movements, daily activities they should be able to do, then recreational activities, then sports activities, then peak performance. They should suppose for lower limb, they should start after walking, daily activity, they should start slow jogging, with long stride jogging, slow running, speed running, sprinting, then jumping. So all these activities should be gradually progressed. Then sports activities, suppose a football player there, the zigzag running and all sort of activities should be given to the specific sports training. Then for the peak performance, like better optimal or peak performance, you have to do certain active like speed training, and all these things has to be given in the latter part of rehab in post-surgical cases. And prevent post-operative complication is also very important. There is hematoma formation, there is malalignment of the bone, there is instability or laxity in the ligament. So this complication can arise after surgery. So that has to be addressed by the physician. It's very much important, because the surgeon has done whatever has to be done, And in spite of that, there will be consequences, there will be compensatory issues there. Suppose the injury is good, sorry, the surgery is good, but when the athlete starts working, he or she worked with until full gait. Is the street is here and the gait is now deviated. So this is called compensatory issues. The athlete is now compensated to relieve pain or to for the comfort. The posture can change, the walking pattern can change. So all these compensatory issues has to be addressed and has to be addressed. So this is for the post-surgical recovery. Next slide, please. Next slide, please. Yeah, recovery and wellness is very important for you, for a coach to know that whenever there is any sort of training or higher form of activities, the body soreness and DOMS, delayed onset of muscle soreness, fatigue, stress and strain to the joints and bone will be there, and the body requires to be recovered on the next day so that again the activities or the training program should be continued. So recovery is very important, and for that the coach and the physio should plan out as per the periodization program, as per the training, as per the competition schedule, what should be the plan for recovery of specific athlete. Each athlete is different, their recovery pattern is different, their food habits, sleep, everything is different. So there should be proper assessment by the physio, that is weekly recovery checklist. How much muscle soreness is there, how much fatigue level is there, whether appetite, भूख लग रहा है नहीं लग रहा है, appetite, hydration, कितना पानी पी रहा है, nutrition level क्या है, protein rich diet खा रहा है नहीं खा रहा है, sleep quality, quantity. Sleep quality is very important. 5 to 6 hours of sleep is very much required. And mental recovery is sometimes the athlete remain in stress, mental fatigue, lack of motivation. So mental recovery is also to be looked into and should be assessed. Motivation level should be assessed. So all this weekly checklist we have to find out. Then say that the formula, there are formulas also to find out the recovery level or fatigue level. Okay, so after proper assessment, they should plan or periodized with related to training load. We should plan for the recovery of the athlete. There is a wellness score, wellness index is there. So there are formulas to find out how much body is recovered or not. And with that assessment, we should employ or we should advise proper recovery methods, like whether hydrotherapy is required or not. Hydrotherapy pool, sort of swimming pool is there where hot and cold water can be there in the pool. So whether hot water bath is required, cold water immersion or cold water bath is required, with jet pressure it is required or not. Ice bath, cryo flow or cryo chamber, one equipment is there. Cryo flow, any body part with like a spray, you can put the cold or cryo application to the specific area. Cryo chamber is there, like you have to go inside, your head outside the chamber, your whole body will be cold. Hot and cold contrast shower is there. Massage, myofascial release with the skilled hand, you have to release the tightness in the sauna and steam bath. Neuromuscular facilitation technique. There are currents available with us, neuromuscular electrical stimulation. There are pneumatic compression therapy to alternate compression of muscle and relaxation. That one machine is there, like it's a massage sort of thing with vacuum. It does. So the recovery massage like effect from the machine can be given. So whatever is required at which phase, which type of fatigue or which type of soreness, you have to advise. You can do yourself, or you can advise the masseur to do, or you can advise any other person to employ this type of methods. Next slide, please. Then the final one is a role of physiotherapy in the performance enhancement of the athlete. This is the final goal of every method, physiotherapy, medical, or any sports science method. The aim is to improve the performance of the athlete. So whatever I said, this is all to make the athlete better, make the athlete perform optimally, and make the athlete perform with increased vigor, increased strength. So the physiotherapist from the beginning, like what I said from the beginning, like planning of the athlete, pre-participation examination, attending to the prevention part, attending to the injury, anything occur, because if one injury occurs, the athlete's life may be derailed, like the sports life can be derailed. So the shortest possible time required for recovery, for injury management is very much important. So the physio does that. And maintenance of all physical and performance related profile or parameters, like what I said, like maintenance of proper agility, proper strength of the muscle, proper flexibility of the muscle, or the person is required for optimal performance in any specific sports. And it is a multidisciplinary team approach. It's just one person does not do all the things. It requires the help of other professionals as well. So through various injury prevention and recovery methods, working on key performance enhancement parameters like speed, strength, endurance, balance, coordination, all these parameters, if you work, you can definitely enhance the performance of the athlete. Thank you. Thank you very much. If any question is there, please ask me. No problem.
Yeah, thank you so much, sir, and thank you for after a lot of disturbance.
Yeah. I am very sorry.
Yeah.
The office internet there I think there is a lot of problems are there.
Yeah, it happens sometimes. So thank you once again for very informative and wonderful session. And I'm sure that our participants are definitely getting a lot of benefit out of this. So thank you, participants. If you have any question to ask from sir, please write in question answer section. And some of the participants already have raised some questions. So I would like to take a few questions. Sir, what is the difference between chronic injury and acute injury? With example, the participant Harikesh Bahadur, he wants to know. Sir, please.
Yeah, I have said that before. Acute injury is a traumatic injury, and suppose the ball hit your leg. You are playing cricket, a ball hit the leg, or your hockey stick hit your leg, or any type of trauma. Suppose you are running and there is hamstring pull, extreme stress to the muscle. So any type of trauma recently occurred is called acute injury. Yeah, and chronic injury is old injuries basically. So suppose an injury occurred and it did not get healed properly. So after a few days it becomes chronic. So it's a old injury. They are called chronic injuries. So in acute injury, how will you differentiate? There will be a lot of inflammation and pain in the beginning. Tenderness will be there. On pressing, there will be pain. On minimal movement, there will be pain. But in chronic injury, there will be minimal pain all the time. You are able to walk, you are able to run, and you feel pain sometimes. Maybe in between, or maybe after the exercise or training is over, you feel pain in that area. So it's a chronic type of old injuries which causes less pain, but it hinders your practice or training. These are chronic injuries.
Yeah, thank you.
Like
Thank you,
scene pain, for example, scene pain is a chronic problem.
Sir, please continue.
Yeah, that's what. Like scene pain is a chronic problem. Acute sprain, acute ankle sprain, if it is it occurred recently, the acute injury of ankle sprain, you can say. Knee injury, any type of injury that occurs recently is acute injury with a traumatic background. And if it is a continuous overuse type of problem like shin pain with continuous load coming to the bone, to the leg bone, then it is called chronic injury.
Yeah, thank you. So I'll take the next question. What is the difference between exercise therapy and electrotherapy? The Kumari Anju Sinha. She wants to know answer. Sir, please.
Yeah, exercise therapy is treatment by exercise. So there are various types of exercise. The basic exercises you as a coach or PT teacher, they may be knowing, like isotonic exercise, isometric exercise, and stretching exercise, weight bearing exercise. All these are basic exercise. And there are specific therapeutic exercise that heals, help in healing, exercise that help in getting function back. There are many exercises like isokinetic exercise, like manipulative exercise, like mobilization exercise, like soft tissue therapy, like movements. So all these exercises are therapeutic exercises that help in regaining function, reduction of pain, improving the function. So there are some specific exercises used for therapy purpose. These are exercise therapy. And electrotherapy means equipment based, like any treatment given by any equipment, any machine. That's electrotherapy. Like I have shown many of the name of the equipments of physiotherapy, like sort of diathermy, ultrasound, electrical stimulation, therapy, pneumatic compression therapy, therapy, therapy electrical agents, basically electrical can be given, electromagnetic therapy. Many are there, many. So these are called electrotherapy.
Hello.
Yeah, next question.
Yeah. So the next question is from participant Birwani Jain. How knock knee can be improved and what are the exercises can be done?
See, knock knee is basically most because of flat foot. Okay, so if you have extreme flat foot, very severe kind of flat foot, then your tibia bone, leg bone, twisted inward, and when both the tibia bone twisted inward, your knee touches each other. Now that is called knock knee. So there can be alignment problem in the knee. There can be problem in the tibia bone, but it's very rare. Mostly it happens with flat foot. Okay, so you have to address the cause. You have to find out what is the cause of knock knee. As I said, mostly it is because of flat foot. So proper arch support to the shoe. Okay, proper insole and proper arch support is advisable for any sports person, any beginner. And if it is extreme, if it is severe kind of knock knee, trouble in walking, jogging, running, then if the person is below 18, then it is very good that you do serial plastering or serial splinting. There are splints or braces available for the knee, which will put the knee in a proper position, align the knee in proper position, de-rotation brace. Like you may have seen the braces, the side there will be metal bars or fiber bars are there. There will be joint at both the side, medial and lateral side. That will fix up your knee joint and keep you in aligned position, not in deviated position. It will keep in aligned position. So knee braces are advised. It should be advised by a physio, properly examined, properly measured, how much it is there and how much correction is required. It's a corrective braces actually. This is called knee corrective braces. The name is knee corrective braces. The braces are available. If it is used before 18 years of age and continuously for 6 months to 1 year or so, at every time going to school or in the home, then there will be correction. There will be definitely correction with the use of the braces. And there are some exercise which is given, like to suppose for the knock knee, there are some muscles that can be weak, like adductors or medial quadricep, like there can be weak. So vastus medialis. So proper strengthening exercise can be given, proper stretching exercise if it is there in any tightness can be given along with the use of brace. The brace is very much important to use for correction of knee, knock knee and arch support in the shoe. There are silicone arches are available. There are customized arches can be prepared. Taking the measurement, you can do customized how much collapse of arch is there. You can do a customized arch support. So arch support, knee braces, and some therapeutic exercise. 3 things are essential.
Yeah, okay. Sir, I'll take the last question as we have time, like out of running time. So the question is from participant Varun Gupta. How to cure ligament and tendon injury?
See, I have said it before, and I am summarizing it basically. Whether it is ligament, muscle, or tendon. Tendon is the extension of muscle, and ligament are elasticated band sort of things which holds the joint. Okay, so any injury happens. The question was tendon and ligament injury. So any injury happens, it goes through 3 phases: acute phase, subacute phase, chronic phase. Suppose acute phase, immediately what you should do? You should apply price. You should apply range of motion exercise and isometric or static exercise in the beginning. Suppose it is going through the it is now, or it is going through the subacute phase after 7 days. Not after 7 days, after 3-4 days also. After 3-4 days, subacute phase, then you can start contrast bar. Okay, alternate application of heat and cold in the ratio of 3:1, then 1 progressing to 1:3. 3 for the hot application. So contrast bath is required in the subacute phase. So after the subacute phase is over, it is the chronic phase. Maybe after 7 days or maybe after 10-15 days, depending on the extent of injury. If it is bigger injury, it will take longer days to come to the chronic phase. Okay, maybe after 7 days, chronic phase started. Then you have to apply pure heat. Just you should not apply any cold or contrast bath. You should apply pure heat in the form of hot water bag, hot water fermentation, any sort of heat application we apply to the part for 10 to 15 minutes. Okay, and exercise also you should progress from passive movement, isometric exercise to stretching exercise to strengthening exercise. That I have said in the class also. To stretching and strengthening exercise, you can start progressive strengthening exercise. So in this way, you will build up the muscle. You will maintain the length of the muscle, maintain the strength of the muscle, maintain the range, the movement of the body part. And after the acute phase, chronic phase is over, maybe it will take 10 days, 15 days. You do all sort of exercise and sort of this basic management. I'm not telling you about any physiotherapy management, just heat application and all these exercises. Okay, so maybe after 10 days, 15 days, whenever the injury subsides, there is no pain, it is subsided, then you will find that you have optimal range of the joint, optimal ligament length, optimal flexibility of the muscle. Everything is good. If you do not manage in the beginning, in the acute phase or in the subacute phase or in the beginning of the chronic phase, then there is a problem. Like suppose we may have noticed after 15 days, after 1 month, after 2 months, if you see any athlete, sir, I am able to work, but there is pain, and now I am working in this way, an antalgic way, because the muscle tightness, stiffness, all this has happened without the proper precaution or proper exercise being carried out in the beginning. So you have to take care of all these things.
Okay, thank you so much, sir, for this session. And participants, I hope that it was very informative session, a very detailed session. Sir has given the information in very, organized way. So thank you so much, sir, for making this session. And on behalf of Ministry of Education, Ministry of Youth Affairs and Sports, Government of India, and on behalf of Sai, Khelo India, and our principal, sir, Dr. G. Kishore, sir, and the entire team from Sai LNCP Trivandrum, thank you for delivering such a wonderful session. Thank you so much.
Thank you, sir, for giving me opportunity, and thank you all participants for bearing me with all disturbed net issues. And if any notes required, you can tell me. I'll prepare and give the notes.
Yeah, please. As per the request letter sent to you, you have to provide, sir. Please send. So
okay. By tomorrow, I'll send the notes. Brief notes,
yeah,
distribute.
Yeah, thank you. Thank you all the participants for joining the second session of the day. And we'll see you in the next sessions. And sorry for again internet issues. We'll make sure that you get the handouts, you get all the notes, so that there's no disturbance in your studies for the examination. Thank you. The poll is already launched. Please take part and provide your valuable feedback. And we will have a session as per the schedule. Please join the session, and your exam details will be update you, and your certificate and all details that will be sending you to your registered email. Thank you. Thank you once again.